whatever. Thank you all for joining NeuroNoodle's Neurofeedback and Neuropsychology podcast featuring our neuropsychologists, Dr. Laura Jansons, Dr. Skip Hrin, and neurofeedback legend, Jay Gunkelman. This is an all-star cast that are more than happy to share their knowledge with you. Dr. Laura Jansons can be found at jansons.com. Dr. Skip can be found at drskiphrin.com. And Jay Gunkelman, he is all over Google. Just look him up. How's that, Jay? Good enough?
I'll live with it.
You'll live with it? Okay. We'll edit that out in post. We recently had a whole bunch of mental health news items come through the wires, and we've been so busy the past few weeks with our guests, we haven't been able to address any of these things. So we figured, let's take a little time on this show and address some of them. For instance, Dr. Laura, you had something on Alzheimer's.
Yeah, there's a new drug approved by the FDA. I don't know how to say it, Aduhelm. And FDA approved it despite having scientific clinical trials to support its efficacy. So, we were talking before the show about how FDA became politicized, and some members of the FDA dropped out and kind of protest, and just kind of a compelling thing that is this drug, $56,000 a year, and I don't know who pays for that, if Medicare is going to jump on board with that price. But you're promising this population, how prevalent is Alzheimer's disease these days, and a large percentage of people over the age of 55 are going to come down with this thing or develop this thing. And so we have this new drug and of questionable efficacy. So that's kind of one issue we were discussing. And then this other issue, how recently that science is kind of being devalued in the last few years and politicized, as if science is a football team and I'm either going to root for it or not. So it's just kind of confusing and compelling that this is kind of coming down in the last few years. And so I guess I'll kind of toss it to Jay and kind of what's his opinion about this, and what are we going to do about it?
Yeah, it was very depressing to see the change in the FDA, and it's extremely obvious in this situation. The drug had two studies to try to support it. One study did not meet criteria, so it's no support at all. And the other one barely met criteria. But the problem was that 19% of the people in the studies ended up with a brain swelling or a brain bleed. And the impact of the drug's positive effect is a very, very slight extension. That's what they're claiming, is a very slight extension in the quality of life. And again, it didn't really get supported in the data from the study. So the independent scientific review board for the FDA recommended unanimously against approval of the drug. And when the FDA commissioners approved it, the scientific review panel had many members that resigned. And I sure as hell would resign. I mean, if you're a scientific review panel and your scientific advice is ignored, why sit on the damn panel at that point? You're being ignored. And this is a travesty, and it's anti-scientific. And it's not even economic, for God's sakes. $56,000 for a medication. I'm on meds to keep me alive, and they're not cheap, but that's unreasonable. And Alzheimer's is not an easy diagnosis. Oh, doc, my memory's not so good. Well, could be depression. Could be a totally other kind of dementia. Come on. You've got a difficult to diagnose category with an over-the-top price on a medication that's iffy for the effect and has a 1 in 5 chance of giving you a bad brain problem. So I don't line up for that kind of stuff. And I'm very disappointed in the FDA. Again, being science oriented, the FDA has always been kind of, a scientific backstop to keep charlatans from producing something and hawking it off to the public. But at this point, it looks like charlatans have produced something and they're hawking it off to the public with the FDA's approval. And that, again, it's a travesty.
So I don't remember a time where people were questioning science at this level. I mean, of course, you should question, science, but the scientific method, there's a reason for that. And what's your opinion, Jay? Like, why in the last few years are they disregarding science and the scientific method? What do you think?
Well, there's a lot of people that have given lip service to science and don't really understand science. It's not a collection of facts. It's a process for evaluating, and I think that's somewhat misunderstood. If quote science changes its mind, it doesn't. It just means that there's been more data and the analysis shows a different outcome. And science does march on. I mean,
Right.
The newfound facts in science are common. We're evaluating the environment and issues all the time. And as new facts emerge, you have to accommodate them in your model. And science is an evolving process, not a collection of facts that are immutable.
Right. So the process, if I just simplify the scientific method for a second, so, there's a couple things that would qualify a study for the scientific method. And some of it has to do with like double-blind studies, triple-blind studies where the researcher doesn't know what the question is. The patients don't know who's getting the real drug or placebo. And so that way there's no examiner effects, interfering with the results. So that certainly has something to do with the scientific method. And the other part has to do with statistically, can we say that whatever the outcome of the study, is that a real effect of the study, or can that happen by chance? And so those are the couple things, and there's obviously more, that will deem a study effective. And, as we're having this conversation, obviously we're the NeuroNoodle network podcast, and we're doing things, with neurofeedback that don't have these kind of studies to back it necessarily. There's a couple, there's a good handful, but a lot of the research in neurofeedback is kind of anecdotal. It's certainly developing, more recently, but maybe that's the answer to my own question is the drugs and the other methods. There are a handful, or people on the bell curve that don't fit the study. We can't represent everybody in a study, and maybe that those are the people who pursue neurofeedback, that all the other stuff doesn't work, or they're outliers and they need something else. So I could see on one hand where you feel like I've tried the scientific method, I've tried those drugs, I've tried these other things that are supposedly working for the average person in my population, but I need something else. So I guess I could see both sides, sort of. I can't see the $56,000 price tag in neurofeedback, certainly not that expensive, but I could see where people are kind of looking for the fountain of youth, and they want to prevent the ugliness of Alzheimer's, the effects individually into the family, and early death, and all these horrible things that can happen with that.
Yeah, I'm
Interestingly,
on, you guys, if you
go
got
ahead.
me. You guys got audio? Okay,
Yes.
cool.
Yep.
I made it. I'm in agreement with everything you guys have said, and back to the Alzheimer's drug approval, and to Jay's point, I think 5 out of 7 of the panelists said no thanks to this thing, but it still went through, right? And then a few resigned, as Jay mentioned. And then Laura, you brought up the number, the 56 grand. It's a giant price tag for this thing. And you and I, in a side conversation, kind of joke, but it's just not that funny. Any good spy movie, when there's no really logical reason for something happening, it's the answer is follow the money. And not to go down that rabbit hole on our show here, but 56 grand paid out by Medicare, like that's taxpayer dollars going into that. It's this ambiguous pool, as opposed to maybe insurance, which insurance is considering covering too, but there would of course be copays and things like that. So it's a head scratcher, and depending on how cynical you want to be, it's not, but it's discouraging for sure. And for the reasons both of you have mentioned, right? You have folks that know what the hell they're talking about saying, hey, this thing's probably not FDA approvable worthy. And then it gets slammed through. So it is discouraging, and it's, gets you wondering what the heck do we go through this process. And I think the drug in particular is intended for early stages anyway, mild cognitive decline type folks. And I think we can all agree that if this thing does get to market and it's out there, somebody who's in advanced stages and maybe has a glimmer of hope, they're not going to care. They'll say, sure, let's do it. There's not much out there that's branded for Alzheimer's treatment, because it is such a multifaceted disease. It's not one thing, right? So that's why nothing's been efficacious so far, because it's hard to corral all the contributions to the symptom picture, right? So anyway, it's just easy to see folks that would be maybe in a desperate state jumping on and trying it anyway. And as you mentioned, Jay, there's some pretty significant side effects. It's a Russian roulette, kind of choice at some level, I think.
Skip.
The price point isn't that far off on other kinds of things, but most of those other kinds of things are really easily diagnosed. The early onset Alzheimer's is almost an impossible diagnosis. Cancer medications, $14,000 a month. But it's quite effective. The rate of lung cancer survival has drastically shifted in the last 5 years. It used to be the average is 10 months from diagnosis. Now people are doing multiple years after diagnosis, a genetically targeted medication. And in a case I was close with, the insurance company wouldn't allow payment for the blood test to identify the genetic med. But once you paid for that, then they would pay for the med. So you had to go out of pocket a fair chunk in order to end up getting approved for it because of the proper genetics. But high-priced meds are not at all uncommon nowadays. Genetically engineered medications are expensive to produce, and believe me, the drug companies are making their money back. Now, they'll claim that they're investing it all in new drug development, but
R&D, right?
Yeah, I've seen the facts on that, and it's bonuses and stock buybacks and PR and lobbying and all of that sort of stuff gets way more money than R&D. So I think that their cover your butt answer that they're doing R&D with all the income is just poppycock, The field of neurofeedback's efficacy being required to have a control study with a placebo is actually not ethical. World Health Helsinki's statement basically said if there's a known treatment that has efficacy, you can't do something to test your alternative with a placebo control. You can put both horses on the track and run them and see which one is better, but you can't make up a placebo horse and put it in the race because it's not ethical. If you're withholding treatment by giving up placebo, you're not being ethical to the patient. So there are people that will demand that neurofeedback have a placebo control, but it's not, I mean, you couldn't get that through an IRB. So the people that are making that demand are non-scientific, and demanding an unethical move, which is ridiculous. The difficulty in neurofeedback is the funding, and studies are small, and they're too small to really make any kind of statement. And the answer to that is meta-analyses. And a meta-analysis basically sets a standard for what kind of study. They look at Scopus and PubMed and look for randomization and control, even if it's a little tiny study, and they group them together and study the larger N. So a meta-analysis is basically the answer to that. Now, in neurofeedback for ADD, ADHD, as an example, 2009, Martijn Arns basically looked at a meta-analysis and found that neurofeedback was superior to sham as well as medication alternatives. And more recently than that, 2014, they showed cognitive training and other control groups were not as effective, suggesting actually in a 2018 review that there was specificity. It was not only effective, but it was also perhaps even more effective than medication. And at that point, they found in the meta-analysis the long-term follow-up. Medications with a long-term follow-up after, not just at outtake, but like 24 months or 12 months later, the medication fails. Neurofeedback remained. But if you look at cognitive training or control groups that had some sort of people intervening and interacting with them and that sort of thing, they also end up having sustained effect longer term. So it's not just neurofeedback that can have a progressive benefit. Medication is just not one of those. And then 2020, there were 2 major meta-analyses done. 4 randomized control studies, 3 open label studies. They basically found remission rates between 32 and 47%. Now, everybody that's probably heard the 80% success stuff, here's a remission rate of 32 to 47%, and they say, well, we do better than that. Actually not. When you put a strict criteria of remission, not did you get something out of your training asked by the therapist, which is a little coercive, you get the 80-20 reaction, but that's not necessarily remission. That's some benefit, but not necessarily remission. When we studied it with an N of 60 with standard protocols and another N of 40 with QEEG-driven protocols, we found that the remission rates, the total elimination of the diagnosis of ADD, you can't diagnose it anymore behaviorally, and a physiological change associated with the training, we found just a little over 30% success. And it corresponds precisely with this 32 to 47% remission rate in the 2020 review. And again, another study by Martijn Arns et al. He publishes a lot, and the quality of the work being done is always exemplary. So, I would love to have the funding to step up with a gigantic study to kind of answer these things, but they're being answered by smaller studies that are well done. Europe has a lot of small study funding. The EU, some individual countries, Germany, Austria, France, and England, they've all funded studies within their own country and those smaller studies end up adding up again when you do a meta-analysis.
John Anderson, brought up the point that I think I asked him, why isn't neurofeedback being taught in the universities? And his response was that there's so many facets to it. You got to know physiology, you got to know neurology, you got to know electronics and physics and chemistry, and there's so many things. They haven't developed departments that teach neurofeedback, and so I'm sure that's part of the reason that there's not funding. I mean, universities aren't funding the neurofeedback research because there's no programs there. In
Europe, they do have programs that
right.
Whole departments that are oriented to it, and have had. I mean, Tübingen University has had a major focus on the neurofeedback area since late 60s, early 70s with Niels Berbaumer's work. When he retired, Ute Strahl took over. Now she's retired. Now their lab has switched its orientation a little bit away from neurofeedback because these things happen as department heads change their interests, drift into other areas. But Salzburg, Austria's consciousness and sleep lab, Graz, Austria's a technical university, Gert Furcheller's lab. These are major universities. Open University in England in 2011 did the first European QEEG and neurofeedback workshop. Yuri Kropotov and I were invited over to teach at Open University. So it's happening more in Europe than in the US. And again, as one of the hippies in the early meetings, I have to apologize for the bad reputation the field got, just being a bunch of hippies. But that there were solid researchers like Sturman and Kamiya. There were military researchers from DARPA, and there were hippies. And the reputation of being just a bunch of hippies is probably not quite correct, but there was a fair number of us in the audience.
Right. So here in the States, we're battling the psychiatric boards. I remember back it was 1992, Lori Russell, someone we've had on the show before, she recently wrote a textbook on neurofeedback and psychotherapy using the hybrid approach. But back in 1992, we marched on Springfield, Illinois, the capital here in Illinois, trying to be approved to be licensed in counseling. So mental health counseling, there's different licenses here, right? You can be a psychologist, you can be a psychiatrist, different training for sure. But the counseling, you couldn't get a license and you couldn't directly get paid for being a counselor. And so, we marched on Springfield, Illinois, up against the Psychiatric Association, and they had, high paid lawyers, and they knocked it down quite a few times and eventually passed. But, that's what we're battling against still. And the big pharma. I mean, how do you, compete with, that kind of bank account? And, certainly that's where neurofeedback, our gloves are smaller.
Hey, Jay, you had shared a link to a video. Is it Thomas Ross? Am I saying the last name right?
Yeah, Ross. Yeah, ROS.
Tomas. Yeah. And
Tomas, not Thomas.
Tomas.
Yeah.
And Thomas Ross over in Alaska, right? Yeah, but Tomas Ross, yeah. And he's in Geneva, and maybe Pete, we can share this in the links, but he does a decent job of going back historically and talking about studies. And, historically in the 70s, there was more giant drop off, 80s, 90s, and then it picked back up and it's increasing incrementally, but substantially now. And he also talks about some of his own studies. So just for folks out there listening, I think he does a decent job reviewing and then pointing out what you're saying is that it is concentrated largely in Europe. There's other places around the world, obviously, but they have funding. It's tough to get just like everywhere else too. But he also talks about maybe the future of neurofeedback, where it might be headed and the possibilities, which is hope, that it gets integrated into medical applications and things. So anyway, I found it interesting and again, hopeful given.
Yeah, and you can see the quality of the science that he's doing too. fMRI, PET scan, neural network identification. I mean, he's at the very bleeding edge of the science. I mean, not quite fully adequate funding, but just enough to kind of squeak by. And his graphics on the number of studies, publishable studies across time, and seeing the bulge of them from initially Kamiya and Sturman, late 60s, early 70s, that surge of interest in operant conditioning of EEG, which was one of the terms that has to be inserted in there, or classical conditioning as well. But you get that burst in the 70s. But the government quit funding studies based on a really bad study by Pashkowitz and Orn, and the government basically just quit funding. And so late 70s, the numbers kind of collapsed. But they sputtered back to life. They barely made it through the 80s.
Right.
Lubar and Sturman were kind of the remaining few. Margaret Ayers, but she wasn't really a big publisher. Eventually things picked back up. I would like to point out that in 1997 on, that graph took off like the COVID graphs did, zoop, some exponential increase.
I'm actually looking at it right now, Jay. Yeah.
Although I can't claim responsibility for it. In 1997, I took over running the meetings for ISNR. The first meeting I held was in Aspen, and we had 75 paying people. And you can't call it a conference. That's like a small enclave, but it's not not a respectable size group. Within 10 years, we had 500 people in the meetings. And I can't claim total responsibility for that, but I planned a really good party, and I invited scientists that didn't know anything about neurofeedback to teach some neuroscience at the meeting and get exposed to neurofeedback. So they would go back to their laboratory infected with a virus of neurofeedback and contaminate their own lab, So we invited people from Europe, and they came over. Their labs were not doing neurofeedback, but they were doing good neuroscience about EEG. So they taught some EEG, but they went back home with the idea of voluntary control over the EEG. And that suddenly entered into their experiments. Salzburg, Austria, Consciousness Sleep Lab. I invited Wolfgang Klemisch, who's the head of the lab, but he was booked already because, they book out a couple of years ahead of time. But he sent over Michael Doppelmayr. Michael's a brilliant young professional at the time. We exposed him to Sturman, and we exposed him to the solid people in the field, and we kind of steered him away from a few of us, but he went back, he flew back, and then was picked up out of Frankfurt and driven back to Salzburg by Wolfgang. And they basically, in the drive back, came up with 3 years of research using neurofeedback in order to test things that they had previously identified. People with slow alpha have poor semantic and declarative memory. People with fast alpha have better semantic and declarative memory. Great correlational study. What about taking the people with the slow alpha and teaching them to speed it up and seeing if that actually is a causal relationship, not a correlation? In fact, they did that study. And when you speed up the person's alpha, their semantic and declarative memory does improve. So, that those kinds of inserting the virus into the entities so it replicates was a dirty little trick of mine, but it seems to have worked because all the major labs in Europe are wide open to neurofeedback. You can go there, propose a PhD and you don't get counseled, well, you should really find something else so you don't, kill your career. In the US, it's been hard to find a university that will offer, a person who wants to do a neurofeedback study, a spot and to do their study in the department. Andrew Hill is in the field now. He's a very powerful young professional and very brilliant. Many years ago now, he called me and said, where can I go for a respectable PhD that will allow me to do a neurofeedback study? And I pointed him to Aaron Zeidel's lab, the brain lateralization lab at UCLA. I knew he was open to neurofeedback. Sturman had been at UCLA. UCLA isn't going to throw you out for it as long as you got a department that can host you. And he went through and got his PhD out of UCLA, focused on neurofeedback. But I couldn't have pointed him at 10 places, that's for sure.
Andrew Hill, Peak Brain.
Yeah, he's a brilliant young guy.
Yeah.
I would suggest if you've got the possibility of seeing him as a professional, you're in good hands.
Can the layman offer a question? Jay, you've been in the biz a while, the 70s. You've been president, I forget, of ISNR. What was the organizations you were president of?
Well, the Biofeedback Society of California, I was president twice. The last time I had got up to leave the board meeting to go pee because I've got diabetes insipidus, and I came back in, they nominated me as the next president and adjourned the meeting. So
okay,
you can't turn your back on these people.
So
but I was president of the then I think was actually SSNR maybe, but it could have been ISNR. Okay. The names has changed,
Yeah.
And I was on the board of APB as the treasurer for 3 years. And
treasurer, that's where I'm going, Jay. If we need bigger gloves, why haven't all the practitioners pooled some money to fund a study? How much does a study cost, Jay?
Well, we did get a recently completed funded study, multiple millions of dollars out of NIH to study ADD, ADHD. There was a study out of Ohio that basically concluded that the neurofeedback wasn't effective. And we looked at their study and they made a foundational mistake in their protocol. They put on an auto thresholding. Auto thresholding is something that the manufacturers have that can change how difficult it is. Now, let's say you're a track coach. Somebody's doing high jump, and you adjust the bar so that they can always go over it. Well, they're not going to get any better. You're defeating the operant principle, and here you're now studying the outcome of teaching people to jump over and lowering the bar so that they can get over it whenever they want. I mean, it's ridiculous to expect operant training, and neurofeedback may not be just operant training, but there's some of that in there as well. But you're defeating the underlying neuroscience of the learning curve, and then trying to conclude what the training does. So actually the author of that study accepted that critique and helped design the final study that was funded. I've seen a triple blind study that used the same faulty auto thresholding. So, the people who've gotten funding haven't always paid attention to protocol. What is it you're training and how? And you can't do a bad job with what you're training and how you're training it and then make a conclusion that's valid. So,
well, I'm just thinking, how many practitioners are there in the United States, in the world? And it would behoove everybody to have a society where money is put in to fund these studies, get the results. a neurofeedback university, you know, NeuroNoodle University, for the lack of a better one. I'm just wondering why that hasn't been done yet, or maybe it will be done.
Well, wind the clock back, look at the field's behavior since the 70s and 80s, and it's kind of like a circular firing squad, you know, and if everybody is aiming in the same direction, we may be able to pool our funds and get something done. But if we're shooting at each other, it's hard to promote the field. Our field has effectively not promoted itself well using the circular firing squad method for the last 45, 50 years. It used to be worse. It's getting much better. The professional societies have kind of broken down the small campism of people that hang around an educational figure, almost like a religion, a guru-y person that has a cluster of people studying under him. And, you know, there were always groups following various individuals, and they would snipe at each other. If you were in one group and you were seen hanging out with somebody in the other group, you became ostracized. So luckily, some of the social events, remember when I was running the meetings, I would plan a damn good party. We had Jimmy Vaughn's band play for us twice while I ran the meetings. I did 8 out of 10 years I ran their meetings. And I would plan a really good party and then invite good neuroscientists. And the field grew really well. And again, it reached people that it wouldn't have reached if it was just the small camps. Winter brain happened in the 80s and 90s, and the winter brain was a social event. There were their meetings had hotel contracts that guaranteed that people could stay in the hot tub all night, and that as long as they weren't grossly too noisy, they wouldn't be kicked out. And it was a gigantic social event, and camps mixed. And gee, those people in this other camp actually have some pretty good ideas, so the cross-pollination. But we still haven't quite gotten away from the circular nature of the field, and we do need to kind of all orient into the same direction and put our shoulder to the wheel. But until we can actually agree on the direction, it's pretty hard. There are groups that basically denigrate studies. Oh, we don't need those stinking studies. We know our stuff works, and we can do everything with it. Well, I'm sorry, but nothing does everything. So let's be real. Actually, do some studies, and not everybody agrees to that studies are needed even. Oh well, like I say, it's a lot better now than it was, but we still have a long way to go to kind of line up.
Who would need to be lined up, Jay? Like BCIA, Stearns? I mean, who?
Oh, those are usually pretty organized entities. If all of the vendors pushed in the same direction, things could move somewhat. I've basically oriented myself to try to support the students more than the organizations even. If the students are our future, it's time to ante up, toss some funds in for the students. I've auctioned off my beard for $17,000 over the years. That's low overhead.
Pay for a third of that drug.
It's underhead, Yeah, but at $17,000 doesn't sound like much, but for students, I know. I actually asked an organization to figure out a way to hand out money to the students, and it took them 3 months, and they said, well, we don't know how to equitably hand out the money. what? If you can't figure out how to give away somebody else's money, you're not really thinking very hard, are you? You know, and it forced me to walk into a student party with a roll of hundreds, and everybody had a student tag. You could tell from a distance from their big green dot on their badge that they were a student. I would say, "Are you a student?" They said, "Oh yes." Well, I peel off 100. Congratulations, you made the right choice of the field, and you know, and you know, hand out $3,000 worth of hundreds to the students at a party, and that's not really a good way to do it. You know, I mean, the first student I handed it to was a young woman, and you know, she was kind of the approach avoidance. I want the $100, but what do you think you're going to get for this, you creepy old dude? You know, so. Yeah, so you know, it's an awkward circumstance to hand it out like that, but it's the best I could do. So, you know, fostering the students, I think, is a really positive way to leverage the field. If you treat,
I don't get it, but I don't get it, Jay. Students don't have any money. What are they going to do? And there's no courses to.
Pete, what's the last name of the guest we had on? Jay would know. Martijn
Arns, A-R-N-S.
So Martijn talked about self-funded studies that they do in their institute. And I remember, Laura, you had some interest in that too. And I was interested, like, hey, how you doing it? Maybe we could converse with him again. Yeah, right. On
Develop a GoFundMe. Yeah, do it a private. Try to get some private investors.
They're doing it, right? And I don't know if you know, Jay, but they're funding their own studies.
I've been involved in those studies.
Yeah.
You know, I used to be able to travel to Europe. I used to travel there quite often and do lectures. And Martijn would set up a lecture for me. And unbeknownst to me, when I walk in the door, he's got 49 ADD cases and 49 matched controls. And I've got to go through the data and sort them for phenotypes and then look to see if a phenotype predicts stimulant response, like the theory of the phenotype paper predicted. Next time I walk in, there's 126 depressives and 126 matched controls. You know, they pulled the data. I sorted them for phenotype. They end up, you know, it's an in-house, no funding. The data is there. They pull the data. They know which one of the ADD, ADHD kids respond to stimulants. They just don't tell anybody who's looking at the data. Actually, after we predicted accurately who responded to stimulants based on the EEG endophenotypes, they offered a $5,000 reward to any group that could get a better reaction or a better prediction accuracy than we did. And there was only one group that tried, the European Vigilance Model folks, and they didn't do quite as well as we did. But they didn't offer the $5,000 to us, that's for sure. So, but I wouldn't have taken it anyway. I would have given it to some student group. So, you know, the students are our future, and if you treat them really well, later in their career, they're going to have limited funds, and they're going to need to make a choice as to what meeting they go to. And if they remember, damn, I had such a damn good time at that one meeting, I think I'm going to go back there. And quite honestly, most of the people that are now presidents and on the board of directors and so forth were students at one point, and they felt a duty to pay back to the society that had treated them so well. Some of them have been president multiple times. So I think treating the students well is one way to, in a very low budget way, leverage the field forward as well.
Okay, guys. So we started with Alzheimer's, $58,000 drug, down to funding for studies for neurofeedback. I guess somebody came to me and said, hey, pitch in $100 because we're going to do this study that will help prove, because we know ADHD has high efficacy, to have this study to make it valid so the insurance companies will pay for it, I would think everybody would pitch in whatever the amount is.
Well, actually, we've got pretty solid evidence at this point. It's just that most people don't know where it all is. Even people in the field don't necessarily track all the research.
Yeah.
And if you'll allow me to share the screen for a moment.
Here, let me get this. And you got it now?
Yep. So this is actually let's get our images out of the way. This is basically a paper that's been produced. It's very nicely done. This is Brainfutures 2020, and it's got a lot of great material in it. You'll see Martijn Arns, David Cantor from the US, this specious character here, Fred Schaefer, who's well known within the neurofeedback world and biofeedback world, and Mark. That it's basically an advisory group to this. You can see it's I would urge you to get a hold of this.
Yep.
Brainfutures.org is an easy spot to find it, but it's well balanced. It's not an overstatement of the science, but it does have all of the detail of the meta-analyses that have been done. You guys talked about the rate of acquisition of the research. They've got a graphic in here, coming up on it now.
If you get dizzy, Jay,
as they say, if you get dizzy, just close your eyes. Here we are. This doesn't have operant conditioning of EEG, so you don't see the early bounce quite the same, but you see the exponential increase starting in the mid 1990s. And here, Scopus, Google, and Web of Science as the three that are being tracked across time. So this document is public domain. You don't, they'll be happy to hand it out to you. But I would suggest that this kind of information ends up refuting those that say it doesn't work, and that we have to have a double-blind, placebo-controlled study. All that kind of stuff is all addressed quite professionally in this publication. So again,
I will put that in the show notes. That's awesome.
Yeah, I do think that the solutions are out there. It's just not everybody ends up focusing on the same kind of support. So,
got it.
And another plug for that, it's not to take away from its importance or just scientific backing or basis, but it's slick too. Like, it looks good. It's easy to read. It's not a journal article, which, to be honest, can be good, sleep aid sometimes. It looks good. It's got color graphs. The information is really digestible. So again, just a plug, an extra plug.
Yeah. And it's not quite as waspy as the field is either. I mean, if you go to the meetings, old white guys, and the brochure ends up having a good mix of people in it, but it's solid science, and it's very well produced. It was produced basically by a group that was hoping to ask for parity. Parity is being treated equally with other health conditions like a broken leg, pancreatitis. I mean, if you've got something medical wrong with you, you get treated, and you get treated. Yeah, they pay for a certain amount of support to help, get you better. Well, Parity was sued for autism in Washington State. The parents won, and the insurance companies have to pay up to $500,000 a year for therapy for the autistic kids. So they're looking with this document to ask for parity for ADD, ADHD, and mental health conditions, which are under fire at this point. There's actually a state that's looking to eliminate mental health coverage to help their budget. Well, if you want to ruin your state, you cut back on your mental health support. So.
Don't go to the ER for mental health. You'll be there for a while. Kids.
Yeah.
All right, guys. We're at time. Great show. We thank everybody for listening to NeuroNoodle's Neurofeedback and Neuropsychology podcast. Dr. Laura can be found at Jansons.com. Dr. Skip can be found at drskiphrin.com. Jay Gunkelman, he's all over the place. Ideas for a topic, please email pete@neuronoodle.com. Please give us 5 stars on Apple Podcasts. Smash that like button on Facebook, Instagram, and Twitter. For everything that we talked about will be in the show notes. Guys, please check up on me. I got pages and pages of notes here. If I forget something, email me and I'll put it in there. Everybody have a great weekend.